Hi everyone, thanks for joining me once again. So, I created today's video to share with you the pathology report I received. If you're watching my channel for the very first time, just to quickly bring you up to speed, back on June 2nd, I had surgery for breast cancer. And in 2014, I was diagnosed with breast cancer and went through surgery and chemotherapy. And then in April 2015, I was re-diagnosed with breast cancer once again and elected to have additional surgery to remove lymph nodes that were found to have cancer. And again, that was on June 2nd. So today is Tuesday, June 16th, and I'm 2 weeks post op, and I just wanted to share with you the pathology findings. So, pathology, what does that mean? Most of you may have heard of it, may know what I'm talking about. So, basically, tissue samples are sent to a lab, and a pathologist is basically looking at those samples to try to determine cause and effect of disease. And so I was able to pull my pathology report after I spoke to the surgeon that had did my surgery on June 2nd to get more details as to what the findings were. So 15 lymph nodes were removed. That's the total number of lymph nodes they found. Last year I had my main sentinel node and 2 nodes removed. They were tested negative for cancer, but either something was missed or the cancer just came back. And so this time around, all lymph nodes were removed. It was a total of 15. And of the 15, 2 tested positive for cancer. That means there was 2 tumors. One measured 1.1 centimeters, and then the second tumor measured 2.2 centimeters. So that's a pretty large size tumor. 2.2 centimeters is actually really tiny, but in terms of tumors, it's pretty large. And they're basically stating I do have metastatic breast cancer. Metastatic is a term used when cancer has spread. But this is considered a regional or local reoccurrence, so it has spread, but it's still in the same area the cancer was originally found a year ago in 2014. So basically, it's still within the breast region. Um, and because of that, I really don't have a staging. So last year I was considered stage 1. With this reoccurrence, staging is a little bit different, especially since it's considered a local or regional reoccurrence versus if the cancer was found like in my lungs, kidney, brain, bone, then it's metastatic and more than likely a stage 4. It was not found there, so I'm not really sure what the staging is. I am waiting to get that information. As I've always said in my previous videos, knowledge is power, and it's better to know more than less. So I'm waiting for that, and I will bring that to you once I get those details. Again, what the stage of this reoccurrence is. Um, the pathology report also stated that extracapsular extension was present, so that means the tumors were big enough that they were beyond the lymph nodes. So they were found in the lymph nodes, but they were big enough that they were more than likely bursting out of the lymph nodes, meaning there could be cancer cells um, traveling within my body. They don't know that for sure, but that is the findings of the pathologist. So basically, the next step for me is going to be radiation, which is going to destroy all tissue um, within the chest wall and within the breast on the left side and the lymph nodes. And then systemic therapy, which is the chemotherapy, which basically treats the full body. So that would be phase 3. Um, Beyond that, a lot of the other reportings is pretty technical. The information is very technical and not really beyond or anything that's going to add or subtract to what I already know. So Um, Two tumors were found. They were fairly large tumors. They were found within the lymph nodes, possibly have spread beyond the lymph nodes within the tissue that was removed. You would think, though, once you have surgery, you've pretty much removed the cancer. But as an extra measure, you do want to continue to treat the body with radiation therapy, which destroys the tissue around the infected area, and then systemic treatment, which treats the whole body, which is handled through chemo. So I want to bring that information to you because when I started this channel, it was based on providing all the information, being transparent, and if I'm going to share it, I'm going to share it all because what I'm going through can and will help somebody else down the line who has questions or just wants to know what's going on or maybe supporting somebody else. So that is my video for the day. It is the Pathology Report, and I'll be honest with you, when I first got the report, I was feeling a little down and whatnot because it's like, wow, for to have no tumors in the lymph nodes last year to now having two, and they're so large so quick, makes me think of a lot of things. Like, was the cancer missed last year? What if they had just taken all the lymph nodes then, even though they were healthy? But they don't do that because that's basically disabling you. So I have limited range of motion in my left arm, and I'm at risk for lymphedema and all kind of other things that a normal person with lymph nodes doesn't have to deal with. But you know what? I'm not going to cry over spilled milk. I can only move forward and be positive and aggressive and fight every day and live every day. And that's basically what I'm doing. So again, I just want to share this information with you. And it's Tuesday and the weather is just beautiful. And I'm staying positive because, oh, this is backwards, but it's Dream Big, Live Big book that I write everything in, and I love it, and it's great, and it's pink, and it's backwards too, guys, so I'm sorry about that. But anyhow, maybe it isn't backwards, but it sure looks backwards when I'm looking in the camera. But anyway, have a great day, everyone. Be blessed, and until next time, take care. And don't forget to check out my other videos. Search Housewife Snob at on the YouTube site. Housewife Snob, one word. Take care, everyone. See you later.